thank you all of the staff today for listening in on what I have to say today regarding employment and shutting down here within the tribes. This was a difficult decision that the Northern Arapaho Business Council had to make for the protection and safety and also for the well-being of all employees and all of those that we serve by coming to our programs. So first of all, I want to say good morning. I'm going to be going back and forth at looking at you and reading what I have here because I don't want to miss very crucial information that you as Northern Arapaho tribal employees need to know. I know that everyone is concerned about the coronavirus epidemic, so we want to share you the tribal government's plan as this pandemic grows in the country. First, I want to thank each and every one of you for your dedication, your hard work, professionalism during this difficult time. The current situation is something that nobody is prepared to handle. We appreciate your understanding that is a situation that changes by the hour. Working in tandem with Dr. Paul Ebert, Chief Medical Officer of the Wind River Cares, and the rest of their team, the tribe has made preparation for this outbreak a priority and done extensive planning to minimize the impact in our communities. The Northern Arapaho Business Council declared a state of emergency that authorized each of the program directors to create and implement a plan for each tribal program. We created a Northern Arapaho Tribe Coronavirus Task Force that meets daily to discuss our preparation and response to this outbreak. This task force provides daily recommendations to the Northern Arapaho Business Council on how to protect the tribe, and we are past the point of business as usual. We all recently heard the news of the gentleman in Fremont County that has tested positive for coronavirus. There's a great concern that it could already be spreading among those he interacted with. This leaves us no choice but to enact drastic measures designed to protect our community and our employees. Therefore, effective immediately, all employees with existing health issues and anyone over the age of 60, we are required to stay home for at least the next 2 weeks. You will be paid as normal, but need to stay home for your own health. Also, additional measures must be established to protect our most vulnerable. Until further notice, all gatherings of more than 10 people are prohibited. Further, the tribe will not process any program expense for the time being during this epidemic. For those that need any use of the programs, please call and schedule an appointment in advance. If you arrive early for your appointment, please wait in your vehicle until your appointment to limit the amount of interaction you have with others. We did not make this decision lightly. This virus is highly contagious, and we are making sure that all precautions are taken to make sure that we do not overwhelm the healthcare system. We plead with you to practice social distancing. This means that the next few weeks you are not on vacation or opportunity to hang out. They are meant to stay home and stay isolated from others. We must all make sacrifices, including ending social engagements and events. However, this is necessary to protect our communities. Healthy individuals can unknowingly carry this disease and pass it on to unhealthy individuals. That is why it's important to limit your interaction with those outside your home for the next 3 weeks. The coronavirus epidemic is something we would rather overreact to and protect our community than to take a laid-back approach and have a disaster. Thank you again for being professional and taking this serious. Together we can protect our community. To talk more about prevention, best practices, and the plan that the Wind River Cares clinics have put together, I will turn this over to Dr. Paul Ebert and Dr. Haley Kazort. Thank you.
So for those of you who do not know me, I'm Dr. Paul Everett. I'm the Chief Medical Officer at Wind River Family and Community Health Center. I've been here for over 12 years now, and like I said, I'm the Chief Medical Officer. This is Dr. Haley Kazort. She is one of our dentists, but in a prior life, prior to being a dentist, she has a master's in epidemiology, which is the study of how these diseases spread. So most of you are aware by now that we have a case of the coronavirus or COVID-19 in Fremont County. What is important about this case is that they could not identify any travel or any exposure to anyone else. And this makes it a case of what we call community spread. That means there's at least one other case in the community that we don't know about, and probably many more. This is leading to not only changes in how the tribe is conducting business, but how the clinics are conducting business as well. And I'm going to explain some of those procedures to you. The Ethity Clinic and the Riverton Clinic are basically closed, except for their pharmacies. Their pharmacies will be open to help people get refills and medications. Currently, there is a provider at each clinic for possible emergencies, but the plan is to not have any patients go through those clinics, or as few patients as possible. As the chairman has alluded to, all these actions are designed to try to minimize possible exposures for people. The thing that is difficult about this disease is that if you're young and healthy, you may not have any symptoms at all. But that doesn't mean you cannot spread the disease. And so all these actions are designed to protect people who are at high risk. In particular, those are people over 60 and in particular people over 60 who have other diseases such as diabetes or heart disease or a bunch of other diseases. But also people under 60 who have those diseases as well as at higher risk. And so we're trying to minimize their exposure. So when you go to the clinic, we have a screening procedure now. As you drive in, you will drive in near the senior center, and they will screen you. They will ask you questions about whether you have cough, fever, or any other symptoms. And basically, one of four things will happen to you. If they talk to you, and they look at you and they decide that you're high risk as somebody who might have the disease, you'll be seen in the modular across the street from the clinic by nurses and providers who are in full protective gear. They're not astronauts, they're protective gear for this. If you have needs that need to be met that are routine, we will try to meet those needs without having to go into the clinic. For example, if you need refills, we will provide those refills for you. You'll wait in your car in the parking lot, and the pharmacy will bring those medications out to you. We've suspended a lot of the rules that usually goes around that go with a lot of those refills. Sometimes we require people to come in at certain intervals. We will suspend most of those rules during this time period so we can meet those needs. If you're someone who they feel needs to be seen that day for another reason and are not high risk for having or spreading the disease, then they may take you into the clinic. For example, if you're a person who's getting wound care, you'll have to go to the clinic. That is not something that can be done otherwise. And in some cases, you may be asked to go to the emergency room if you are really high risk, period. We're following these recommendations because they come from the Center for Disease Control, and because, like I said, we want to minimize exposure. I know this is a pain for a lot of you, and having spent years trying to talk some of you into flu shots and having you say, oh, I'm young, I'm not going to get it, or it's not going to affect me that much, that may be true. But you are exposing other people if you get the disease. And in particular, we are very concerned about our elders. Those are the people who are dying from this disease. And those people are very important as people, they're very important to us, and they're very important to the tribe as a cultural resource. So please be patient. Don't get mad at our people out in the parking lot who are screening you. Don't be yelling at my pharmacies. This is the reason we're doing this, to protect people. The chairman's already alluded to the things that you need to do to protect yourself. That includes hand washing. That is for, we We recommend that you wash your hands frequently for 20 seconds. You can do this by singing happy birthday to yourself twice. The social distancing, do not gather in groups. Even when you're talking to somebody, stay a little farther away from them. Don't shake hands. You see a lot of people doing elbow bumps, which is okay. We recommend that maybe just wave. And then limit all unnecessary travel. The Arapaho tribe actually has been ahead of the county on this. They've reacted swiftly, and you can tell by the actions they're taking today, they're working very hard to also help us limit that thing. I think the Wyoming Indian School was the first school in the state to close down. Other schools were questioning this, and the next day the governor came out and recommended that all the schools close. So we are all working very hard together to try to minimize exposure, to try to keep the number of cases down in our area. We feel like our members are particularly at risk because, as you all know, extended families are very important to the tribe. A lot of extended families live together. We have multi-generational homes where you may have everything from a new baby to grandma, and it's especially grandma and grandpa and sick people that we're trying to protect. Because if you bring it into the home, because you don't think this is important, you could put them at risk, even at risk of death. So please follow the rules that the tribe has set up, that the CDC recommends, and that we're recommending. I'm going to let Dr. Kazur make a few comments to sort of reinforce this.
Thank you, Dr. Albert. I think it's just really important to again emphasize that there are many people that do not exhibit any symptoms. That doesn't mean that you're not infectious, and that doesn't mean that there aren't other people in your home that could then get the virus and show symptoms and unfortunately could have to go to the hospital or even death. So if you even have a few symptoms or feel bad, very important to stay home. Social distancing, very important. Even if you feel well, somebody who's high risk in your home, whether it be a grandparent, a parent, a child that may be undergoing chemotherapy, or even a child that has asthma, they're high risk as well, even if they are young. Very important to do social distancing, making sure that we're washing our hands, and just being precautious with our most vulnerable. It's also important to note that there isn't a cure for the virus. So just because you do get a positive test, healthcare providers cannot do anything to cure you. It's up to you to do social distancing and try to keep those close to you, away from you, and to try and be healthy and to stop the spread. If for any reason you do have to go to the emergency room because of severe symptoms, you should do that. If you have mild symptoms, stay home. We want to keep those emergency rooms available for the people that cannot fight this on their own. So, like I said, just take precautions. Social distancing is going to be the most important thing we can do. Thank you.
One more thing that I would like to mention is the main symptoms of the virus are cough, fever, and shortness of breath. Unfortunately, that sounds like a lot of other things that are going around right now, like flu in adults and RSV in children. A lot of you are going to want to be tested, but despite what you're seeing on TV and what the feds are saying, we still do not have widespread testing available. Because we're in a rural area, our testing depends on what's called viral transport media, where we take the swab, we put it in something to transport it, and then it goes to Cheyenne. There's a very limited amount of that media available right now. So we have limited testing. We would like to test everybody who wants to be tested. We'd like to test everybody that we want to be tested, but right now we have to pick and choose who we test. So, like I said, we would like to test everybody. They should have those tests out, but despite what you see on TV, they are not readily available yet. We are doing our best to try to. We actually have more tests than anybody in the county, but it's still not very many. We're down to about 15 tests, I believe. So, Well, thank you very much.
We will have more information as it becomes known. We will be doing updates on our Facebook page. So we are working closely with our medical team to ensure the best practice available for us here as a tribe, the Arapaho tribe, and as a community. We will be working with the Eastern Shoshone Business Council later today. And also, I have asked the staff of our Governor, Mark Gordon, if I can have a few minutes of this time via phone call. So we're working with everyone. Your council is working hard to ensure that you have the most knowledge available to help you in this crisis. And so we thank you for your time today. This portions of this video today will be accessible to the public via our Facebook page and northernraffle.com. So thank you all.